Okay, starting with hemochromatosis. Now, hemochromatosis it is due to iron deposition. Before proceeding further, some general points about iron metabolism are Fe2 plus is generally more commonly absorbed and absorbed to a greater extent than Fe3 plus. And also iron mostly is absorbed from the upper part of small intestine, that is especially from the duodenum. This increased iron pigmentation can occur from a primary cause or from a secondary cause. Now, practically thinking, primary cause is due to a genetic defect anywhere. Secondary cause is due to some external disease or another factor which will lead to increased iron deposition. So, repeated blood transfusions is the most common cause which will lead to secondary hemochromatosis. This primary hemochromatosis is due to a genetic defect that is in the HFE gene. The HFE gene is located on chromosome 6. Now, whenever there is increased iron deposition, this iron will get deposited in various tissues, various places in the body, and each of them will lead to a different clinical manifestation, and features all the lab investigations also vary accordingly. The first important manifestation being increased deposition of iron in the skin. Now, this leads to increased deposition of iron in the skin will lead to increased skin pigmentation. This increased skin pigmentation is called, the skin now is so known as bronze skin. Okay, this is bronze in color. The same thing, if there is increased iron deposition in the pancreas, okay, this will lead to destruction of beta cells of pancreas. So when beta cells are responsible for producing insulin, which helps in lowering the glucose levels. Now when insulin is not produced because beta cells are damaged, so obviously it will lead to diabetes mellitus. Now this diabetes and bronze skin, the combo is called bronze diabetes. Same thing again, increased iron deposition, if this occurs in the pituitary, it will lead to hypogonadism. In the joints, increased iron deposition in the joints, it can lead to arthralgia. Increased iron deposition in heart. Now, this is a very important manifestation, that is cardiovascular manifestation, because it will lead to dilated cardiomyopathy. But a very important point here again is generally dilated cardiomyopathy is considered irreversible, but a reversible cause of dilated cardiomyopathy is hemochromatosis. So this is a reversible cause. Right, continuing our discussion, there's a very important point here, that is which of the manifestations of hemochromatosis are reversible, which of them are irreversible. Now these are very important for exam point of view. So reversible manifestations, there are very important reversible manifestations. The first one is dilated cardiomyopathy and the second one is skin pigmentation. Okay, the bronzeness of the skin. Once you decrease the iron content or you give any treatment for the iron deposition, then these both will reverse upon decreasing the iron load. Important terms here are transferrin and ferritin. So ferritin is the storage form of iron and transferrin is which iron is bound to be transported to various organs. So here in hemochromatosis, there is increased transferrin saturation. Because there is actually increased iron production is more iron, there is iron to get more iron is getting deposited, so more of transfer is happening, so there is an increase in transferrin saturation. This is also used as a diagnostic tool, but it's not confirmatory. Now here the confirmatory is always genetic testing of HFE gene mutation can be tested. Another important like liver biopsy can also be taken because there is hepatomegaly and destruction due to increased deposition of iron. So liver biopsy classically with Pearl stain. This is also an important diagnostic tool for hemochromatosis. Another important point here is ferritin is also an acute phase reactant. So it is generally increased during any of the inflammatory conditions also. Now another point, now treatment of hemochromatosis. Treatment of hemochromatosis is generally venesection, or we can give any chelating agents like desferoxamine. Generally, venesection is done for primary and chelating agents, that is desferoxamine, etc., are given for secondary hemochromatosis.